Hi guys, welcome back to my YouTube channel. You guys, our channel is growing. It means a lot to me that you find my content valuable and you have subscribed and you are watching my videos. If this is your first time coming across this channel, my name is Dr. Angelica Obaye. I'm a licensed medical doctor practicing in Nigeria, and I opened this channel to share a bit of my knowledge about medicine, how to get into medical school, and my thoughts about societal events and the likes. So if this is what you like, please comment and subscribe to all my videos, and I'll be sure to drop more of them as time goes on. A lot of girls and women suffer from dysmenorrhea or period pain. So how does period pain or dysmenorrhea occur? There are some chemicals called prostaglandins and leukotrienes that line the uterus. When a woman is approaching her menstruation, these chemicals are produced more, and they are responsible for the pain that women experience during menstruation. So you observe that the pain reduces as the period progresses. The pain is usually more severe in the first and second day of the period. Mind you, there are also cases where the pain can last for the entire length of the period and it does not reduce in severity, rather it gets worse. This form of dysmenorrhea is called secondary dysmenorrhea, and it results from a pathological condition, which means a disease process is responsible for this form of pain. So it could result from untreated chronic infections like sexually transmitted infections. It can also result from endometriosis. Endometriosis is a condition where the lining of the uterus is found in other parts of the body. For instance, in the fallopian tube, the ovaries, or even the chest during the hormonal changes associated with the onset of menstruation. These linings in other parts of the body also bleed and can cause severe pain. Fibroids are a common cause of dysmenorrhea in women, especially black women. If you're having a period as a black woman and your periods are very heavy, you have large clots of blood in your pad or your tampons, and you seem to be always fatigued during the entire length of your period and even after, go and see a gynecologist. Another cause of secondary dysmenorrhea is adenomyosis. This is a condition where the lining of the uterus starts growing into the muscular layer. It can also cause pain. Some remedies that can be done to relieve period pain while at home include stretching and aerobic exercises. You can do a yoga, you can swim, jog, you can do some moderate to light exercises. Engage your mind in relaxation and sleeping. These have been shown to relieve the pain. Although in some cases, for instance, if the woman has a fibroid, this may not work. Another way to relieve period pain at home is to take a warm bath or to get a hot water bottle and place on the lower portion of the abdomen. You can also take some warm fluids to help with the pain. If you have been experiencing persistent period pain that is interfering with your daily activities, the doctor will prescribe some medications to help with the pain. The most common medication we prescribe are called NSAIDs. These NSAIDs reduce the production of prostaglandins, which are responsible for this pain. There are some conditions where your doctor will not prescribe these NSAIDs for you. If you have asthma, a liver problem, or stomach ulcers, the doctor may choose to prescribe another medication for your use. It is important to recognize the impact of period pain on women and girls, especially because period is associated with other symptoms like vomiting, diarrhea, nausea, and even fatigue and drowsiness. Let us take cognizance of these facts when relating with adolescent girls and women, and try as much as possible to offer the best emotional and physical support to these people. There are instances where it's advised for a woman to go and see a doctor. 1. If the period pain is increasing in severity and duration. Remember that in primary dysmenorrhea, the pain is expected to reduce as the period progresses. However, if the reverse is the case, please go and see a gynecologist. Rule out any pathological conditions. The second one is if you're having chronic pelvic pain. It could be constant, intermittent, it could be related to your cycle, and it is usually associated with untreated or poorly treated sexually transmitted infections. I recommend that you go to the gynecologist if you're having intermittent or persistent pain in your pelvic region that has lasted for as long as 3 months, 6 months, or even more, or you're having persistent pain in your chest or in any other part of the body during your period. Please go to the doctor. This could be a form of endometriosis. As a Black woman, remember, fibroids is a common cause of period pain. If you're feeling a lump or a mass in your abdomen, you find it difficult to stand up or to perform light chores during your period due to fatigue, and there are heavy clots of blood in your pad during your menstruation, go to the doctor to be evaluated for fibroids. So I hope you've learned about period pain and what you can do. Send this video to every girl and young woman in your life to help them navigate this process. Thank you so much for watching this video. Bye.